मणिपाल हॉस्पिटलाक सरकार फावो ती मदत दितले अशें भलायकी मंत्री विश्वजीत राणे हांणी सांगलां। ब्रेस्तारा मणिपाल हॉस्पिटलांत आयोजीत केल्ल्या पत्रकार परिशदेंत ते उलयताले। ह्या वेळार मणिपाल हॉस्पिटलाचे दोतोर शेखर साळकर आनी हेर वरिश्ठ दोतोरूय हजर आसले। मणिपाल हॉस्पिटलांत पयले मेंदू मरणाची घोशणा केल्या। आरडीएक्स खातीर पणजेच्यान संजय मनोली।
The government of Goa, fortunately with the leadership that we have, especially in the Director of Health Service, who has promulgated this order which talks about the brain death declaration panel. So they have recognized a certain set of doctors who are empowered to come and examine patients who are on ventilator and define whether these patients have this terminal brain death or not. And that is not just one doctor who is empowered, there is a panel of 4 doctors. Brain dead, my friends, is dead. What happens here is a patient who has suffered injury and is on a ventilator, but the brain is getting perfused. If you do an angiography, you see that the brain is getting perfused. A patient who is diagnosed by the 4 doctors with brain death, the brain is not getting perfused.
The first case in the state of Goa that is being announced by Manipal Hospital. This is not an easy thing to move forward. This is something which is very difficult to do, and they have taken the right direction in moving forward. I think it's not only brain death, but how a single person, where in consultation with the family, where this brain death along with the panel that has been set up, which is declared not, will also save several lives. And I think this is a very good step forward. I would like to assure Manipal Hospital and Dr. Shekhar Sarkar and the team and also the IME that this government under the leadership of Mr. Manohar Parrikar will do everything possible to support different initiatives. Our whole effort is to save lives. I would also like to congratulate the executives of IMA Goa Chapter 2017 for having taken this initiative to bring it to this level today. And our team, which they have already announced, has supported this initiative of Manipal Hospital. And we are also going to see that brain death declaration is also done and taken, and the same system is followed even in Goa Medical College. And this we will do with immediate effect. I have already had a meeting today before coming for doctors program, this announcement of brain death. I have already talked to the dean. So this is an important milestone and step forward taken by Manipal Hospital, and I can assure them that whatever help and whatever support they require in moving forward, we will give them whatever support that is required by our health ministry.
The organs become the state's responsibility. It is not that Manipal Hospital patient dies here, the organs, we will distribute the organ. The organs are distributed by state authority, and they have there is a systematic website आसा तांची सगळे कोणा कोणाक दिवपाची कशें ती, who are on the waiting list. Children will get a priority, then young people will get a priority. So all these things पळोवन ते दितले. आणि suppose death occurs in Goa आमच्या Manipal Hospital, one kidney, suppose 2 kidney आसा, one kidney will be given to us, but one kidney will go to GMC. So government sector also benefits when these things happens. Because normally government sector इतको टाइम नसता तांचे कडेन तो वेंटिलेटर घेवन बसपाक आनी ते सगळें करपाक, कित्याक दे आर सो बिजी आनी तांचे तो लोड चालू आसता. पण इन प्रायवेट सेक्टर वी हॅव सीन इन अपोलो हॉस्पिटल इन चेन्नई ऑल्सो, वेन दे हॅव डन अराउंड 200 kidneys were given to the government sector. So the poor people also benefit because they are normally having a waiting list in the general hospital. Affording people can go. But now with the DDSY scheme, because in that even this transplant is this little bit modification may be required. People even here if they do get, they will have a minimum expenditure. So I feel that scheme also you need to little bit much refurbish the जाल्यार सगळ्या लोकांक हाजो फायदो जावंक शकता.